The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
It's called excitement, bro. Suleiman Rafiq, how are you, brother?
Alhamdulillah, I'm very well. How are you, Fahad?
Alhamdulillah. See, when I'm feeling excited, it's happened. It happens.
Oh, that's fine.
This program is broadcasting live from the studios of Inspire FM today, Thursday, 18th of April, 2019 at 6 p.m. and casting its positive vibes to all our lovely people in Luton and the surrounding areas like Dunstable, Harpenden, Bedford and all the areas nearby. You can listen us to the Inspire FM website and web app, and if you are listening this show on Sunday or any other Thursday, that means it's repeat. Luckily it's not. As we all know, we cover different health-related topic every single day, every single week, and today we are, as I said in the beginning of the show, we are covering two topics today. The first topic, or the first half of the show, we will be covering the MMR, the information about MMR, and definitely for that we will have our guest in the studios and on the phone. And on the second half, we will be discussing the healthy Ramadan, and that is highlighting the Ramadan, which will be starting in about 15-16 days time, inshallah. Isn't it, Salman?
Inshallah.
And are you prepared for it?
Hopefully after today's show I'll be more prepared.
Alhamdulillah. So without further delay, let's introduce our guest tonight. As I said, I'm feeling extremely honored, and thank you so much, Suleiman. It's all Suleiman's help to arrange such a lovely guest today. So let's introduce our guest in the studio first. Starting from my right is Dr. Uzma Sarwar. Assalamu alaikum.
Walaikum assalam.
And sitting next to it is Dr. Shahnaz. I forgot your surname.
Akbar.
Shahnaz Akbar. Assalamu alaikum.
Walaikum assalam.
I'm so sorry. It's called excitement. Sorry about it. I'm extremely excited to see such lovely people.
It's been a long time we are talking each other now.
How are you, doctor?
I'm good.
And next to Dr. Shahnaz Akbar is Izzy. Assalamu alaikum, Izzy.
Walaikum salam.
How are you?
I'm good, thank you.
Now, I will ask everybody to introduce themselves, but we also have our guest on our phone. So let's introduce the guest on the phone as well. Fiona, hello.
Hello, good evening.
Good evening. How are you?
I'm all right, thank you.
So let's ask all our guests to introduce themselves and give a bit of intro about themselves. So let's start with you, Fiona.
I'm Fiona Anaman. I'm one of the immunisation coordinators working for Public Health England, but we work within the NHS England offices, and we work quite closely with all immunisers, GP practices, and hospitals, and also children's centres, schools, anywhere where immunisations take place. We work with those staff to ensure that the immunisation programs are working as they should.
Anybody who needs jabs, you are there for them, indeed.
Right.
and lastly but not leastly, my very friend Suliman. Suliman, now you introduce yourself.
Yes, Suliman Rafiq, Fahad's co-host for today.
And yes, definitely, during the daytime he works as a legal person as well. But today he's there as my co-host. Izzy, let's start with you now. Introduce yourself, please.
I'm Uzma Malik. I work as a nutritionist for Total Wellbeing Luton, which is Luton's integrated healthy lifestyle service.
Mm-hmm. And Dr. Shahnaz Akbar?
I'm Shahnaz Akbar. I'm a consultant gynecologist and obstetrician and subspecialist in reproductive medicine and surgery at Luton and Dunstable Hospital. I also lead the fertility services at Luton and Dunstable Hospital.
And definitely, and Izzy and Shahnaz will be answering most part of the questions on the second half of our show, which is Healthy Ramadan. And on the first half, which will be led by Fiona and Dr. Uzma Sarwar. Let's ask Uzma.
Hello. So I'm a GP locally, and I also work in the CCG as paediatric clinical director. So have a hand in both.
Exactly. So let's ask the GP first. What is MMR?
So MMR is the vaccination for measles, mumps and rubella. Now this is really important, and it's the reason why I wanted to highlight it on this show, is that locally we don't use vaccination of MMR very well compared to the national and what we should be using it. We're kind of around the 80% mark, whereas we should be around the 95% mark. So people aren't using it, widely, and I'm not sure 100% why, but this is, it's important. This is the health and well-being of our children and also our adults and pregnant ladies and everyone else. So this is it's an important topic that I think we should kind of cover.
Definitely, and I definitely like to know who should receive these vaccinations. So let's ask Fiona. Fiona, who should have these vaccinations?
Well, generally, the vaccination is available to anybody that wants it, anybody that has not suffered the diseases or has not had the vaccines. But routinely, we give it to babies around 1 year old, 12 months old. They can have the first dose, and then they have the second dose at around 3 years and 4 months before they start school. So it's usually 2 doses to complete the course.
Right. And let's ask Doctor. Is MMR harmful, Doc?
So it kind of depends what we mean by harmful, in the sense of, yes, it is a jab, and it has some kind of side effects. So we might say people might feel unwell for a few days, or they might get a bit of diarrhea, something like that. But it shouldn't be as such harmful or seriously harmful. The only thing that I would say is that there is a slightly increased risk of febrile convulsions. But
when you said febrile convulsion, what do you mean by that?
So that's fever-related. Sorry, that's fever-related convulsion. So it's a little kind of shaking, and is quite rare, but it still does happen in 1 in 3 to 4,000 people who get the vaccine. So it is quite rare. So I would say that overall, the vaccination is quite safe. It's quite widely used. It's used across the world, and we haven't seen any serious effects from it. The main thing I think people worry about is the autism link that was brought up in kind of 1998. There was, a paper released that said if you get the MMR, you're more likely to get autism. Now that was retracted, but it was widely kind of seen, and then, the newspapers took it up, and everyone was really worried, like, oh gosh, is my child going to get autism? That is completely untrue. Okay, so there have been massive studies now looking at the links and if there are any links, and the latest study was in Denmark, looking at 650,000 children, and they were followed for 8 years to see if they kind of had any autism links. So it's, you can tell that people have really looked at it now, and actually there's no difference in rates of autism with those who are vaccinated compared to those who aren't. So actually it's, it's pretty safe in that terms. And I would say, I've got a child who's coming up to 1, he is definitely getting it.
Oh, definitely.
Yeah.
So let's involve our listeners as well, because I have not invited our listeners. So listeners, if you have any questions or queries regarding our show tonight, please do give us a call on 01582 481822. I repeat, 01582 481822. And Suleiman, what's the mobile number they can text on?
They can text or WhatsApp us on 07779 481822.
I repeat,
07779 481822.
come on, Salman, you should remember this number by heart.
I don't remember any numbers by heart.
It's there.
That would have been a lot easier.
So let's ask Fiona about how this vaccination works. So Fiona, how does this vaccination work?
Well, it works by you have the injection, the first dose, and it usually produces cells which your body will be able to recognize and remember at a later date should you come across any of the 3 viruses that are contained in the vaccine. So if you're in contact with any of the diseases in the future, these cells will wake up and activate your body to rapidly produce antibodies, and thereby fighting the disease much quicker than somebody who's actually not been vaccinated and doesn't have any of these memory cells in their body.
That's interesting. That is interesting. And no doubt about it that it is definitely necessary for all our kids to have it, and adults if need to be. But as all a vaccine goes, sometimes we normally ask, being Muslim, that is it halal or not? So Doc, what do you reckon? Is it halal?
So there is let's call it a vegetarian option.
Okay, I like that.
I will explain why. So there is a vegetarian option. It probably isn't the standard in the GP surgery, but you can ask for it, and it can be requested and obtained for you, basically. So if you're worried about that, then definitely there is a vegetarian option. I would say that different schools of thought, some will say that you're allowed vaccination because it's to promote your health, and in the same ways that medicines are allowed.
So let's take steer from Fiona. Fiona, what do you reckon? Is there any what is the difference between the 2 versions of MMR?
One of them has got porcine gelatin, which is used as a stabilizer, and the other one, which gives it a longer shelf life, and the other one hasn't. So as the doctor said, you can request the one that doesn't have the porcine gelatin if you're concerned. But both vaccines are quite safe to have, but you can understand why people might want to choose the one that doesn't have the porcine gelatin.
But how do a common person like ourselves know that it has or hasn't?
Well, they've got names. So if you ask for the Priorix one, is the one that doesn't have the gelatin in it. So usually most practices actually order a combination of the two, because the two vaccines are available from Public Health England, and the practices can order them centrally at no cost to the surgeries, because they are bought by the Department of Health. So they can usually, most practices will ask for a combination of the two to be able to accommodate the ones that might have a preference to one or the other.
That is quite interesting. So, Doc, in your opinion, is it easily available if a patient normally go to the surgery?
I think, obviously as a patient, you would have to kind of check and request it. You probably will hear from a practice nurse who says, "Oh, I don't know about that," and and with the best will in the world, they probably haven't, and that's fine, because the option is available, and it's they should be able to get it for you. So I don't imagine it to be a difficult task to get it.
Now, in that lines, can I ask, is it just the kids who normally get vaccinated, or is it adults as well? Or if it is, then why?
So at the moment the regime is to start the immunisation as kids, and as we said, at about 1 year old, a child will have his first or her first MMR jab. Now, if you haven't had an MMR jab, then at any age, yes, go seek a health professional and tell them you need an MMR jab, and you will get one.
Regardless of their age.
Regardless of their age, we're looking at school age and kind of young teens and early 20s are more likely to be, if they're not going to be immunised, it'd be that age. But if you're not immunised, you can definitely ask for one. And normally what I would recommend as well is, if you're going to a country like, say, a lot of our listeners will say be Pakistani or Indian or from Bangladesh or is Indian subcontinent, those type of countries may have more incidence of these diseases. So it's really important to think about that when you're thinking about travel. So I definitely recommend it if you're kind of thinking about it.
Okay, Suliman, I think so. You wanted to ask something to Fiona.
It was just a reflection, firstly, just in terms of, as you mentioned, a number of us are parents.
Yes.
And so my daughter's going to be one on the 25th of April.
Mashallah. Where's my invite? Where's my invite, man? Come on.
But I think it's just interesting reflecting on what's been discussed so far, that, as parents, we want what's best for our children. And often, when you hear words like measles, mumps, rubella?
Yes.
Rubella.
Yeah. They almost
not
sound...
Rebecca. No. Not on the live radio. Come on, mate.
They almost sound like quite ancient diseases to me. But the reality is that without this vaccination, which we're very fortunate to have in the UK, free of charge, without this, then it is something that can affect us in England. It almost sounds like a disease that wouldn't necessarily be in Europe. But the fact that it is very much required for all of our children to be vaccinated in order to protect the whole of our community, for me is quite surprising in a way. And so as I think was said earlier, is that this is something that you really have to be engaging with, and for me, if you want to know more information and speaking to professionals, and that's great, but fundamentally it's not something that can be ignored. And I think it was just more of a reflection on what's been discussed so far around some of the intricacies around the topic. The bottom line is that, isn't it? Is that we need to be making sure that our children are getting protected around.
But what if we got
it? It's quite a horrible thing, isn't it?
Yeah. But what if if an adult got it, that's the thing. Because if I'm not mistaken, there's a very big outbreak in Luton recently regarding MMR measles, isn't it? So if if anybody thinks that their children or adult got measles, what they should do?
What
Fiona?
they should do is, if they think somebody has got measles, we're trying not to spread it further. Obviously, it's quite rightly mentioned, we do have outbreaks in Luton and some parts of Bedfordshire and Hertfordshire. So we're trying not to spread it further. So if you think you've got measles, it's quite important that you phone ahead. You phone the GP practice or the hospital, wherever you're intending to go, so that when you arrive there, they can put you in a side room and do the necessary checks, so that you're not waiting in the waiting room together with other people. Because if you do have the disease, then it's highly infectious disease. You can quickly spread it to other people. So we're trying to avoid that.
And if I'm not mistaken, Shahnaz, it's also harmful for pregnant ladies as well.
Yes, of course. Before we treat them, we make sure that they are immune to rubella, and it's a mandatory thing.
All right, okay. And Izzy, what do you reckon about the healthy lifestyle for kids and to avoid MMR?
Just maintaining an active lifestyle and eating healthy from the beginning, so that they're getting the nutrients and minerals that are needed to boost their immune system to supplement the vaccination.
And Doc, what are the signs and symptoms? So if how a person can understand or realize that yes, they have it. Or not to have it.
It's actually harder than it looks. I'll say that first.
Not the spotty person.
Yeah, absolutely. And so you have to understand that most of these are viral. All of these are viral illnesses, and they can present kind of just with fever, cough, diarrhea, all those type of small issues, or mostly with measles and rubella more actually. And then measles will have this characteristic rash. So that rash has, a GP should be able to identify, or if they're worried about it, they will then ask for further testing. The problem is that there are serious consequences to things like measles, and you have to recognise that measles is one of the most contagious infections in the world.
Really?
Yeah. So more than flu, more than Ebola. Okay.
Wow.
So that's how infectious it is, and so it's
repeat that. It's more than a flu.
More contagious than flu, and more contagious than Ebola. So this is so it doesn't have.
Now I'm feeling scared. I'm feeling scared now.
So if you think in a room of 100 people, more than half of them will definitely get it if they're exposed to someone who's had measles. So if they're in that room for 15 minutes, so that's it tells you the level of infection that can spread, how quickly it could spread through, say, a school or even a waiting room. And so it's really important to kind of keep people, if you suspect it, to separate them but let people know as well. So it is really important. But so measles for me is the most serious out of the three, because it does have consequences that include permanent disability, brain damage, pneumonia, and in some cases death. And I know that sounds quite scary to be saying on the radio, but it's actually it is one of the things we measure globally and in the UK, how many deaths are happening because of measles. So I don't want to scare the listeners, but I do a little bit. But yeah, wow. So go get your kids immunised.
Yeah. Just to back that up in terms of before the programme, where I was just doing a little bit looking into measles. So Public Health, because it's been 50 years since the programme started, and Public Health England estimated that 20 million measles cases have been averted in the UK since the introduction of the first measles containing vaccine into the childhood immunisation programme. So you think 20 million measles cases have been averted as a result of this programme, which was 50 years last year. So it really is something we're very fortunate to have access to across our population.
Wow. We just have literally 2 minutes to end this part of the show. So let's take a quick advices from everyone. So Fiona, let's start with you. Do you have any advice or any quick tips for our listeners to share?
Yeah, if you're not sure that you're vaccinated, you can contact your GP practice and they should be able to find that information for you. If you think you've got measles, like I said before, call ahead so that we don't spread it to anybody else. It's a very safe and effective vaccine. So please, let's protect ourselves and our children.
Okay,
Thank
cool.
you.
Thank you so much, Fiona. Dr. Sarwar?
Just echoing what Fiona has said already, and so if you're at home and you don't know or you think you haven't had it, go get it done. Go get it checked. Don't wait.
Definitely. If you are in doubt, definitely go and get checked. And keep if a person who have measles, please keep away from pregnant ladies, if I'm not mistaken, as Shahnaz said earlier. So as we are approaching quickly towards our first half of the show, I will thank Fiona, our guest on the phone, to be part of the show. So thank you so much, Fiona, for coming to the show and being part of the show and sharing this lovely knowledge with us.
Thank you for inviting me.
You're most welcome. You definitely did it the first time, but not the last time ever. So you will be called again, inshallah. Okay? Thank you so much.
Sure. All right. Thank you.
And that was Fiona, and we will be back after these very short messages.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm your host for the second half of today's show, Suliman Rafiq, and have the envious task of trying to come after Fahad Matin's enthusiasm. So I don't think anyone can quite match that, but hopefully we've got some fantastic guests that will be able to bring some insight into the second half of the show. So for those of us who weren't here in the first half, just to recap, we were discussing MMR, friend or foe, and if anyone would like to listen back to that, then you can do so on the podcast or the repeat on Sunday, or the Facebook video which stays on Facebook. Is that right, Fahad?
Yes, indeed.
Fantastic. So
yes indeed, and you can do the same enthusiasm, Suliman. But hey ho, that's you.
That's me. I'm slightly different style to it. Absolutely. So just to recap, this program is broadcasting live today on Thursday, the 18th of April 2019, from the studios of Inspire FM. And I'm delighted to say we still have in the studio with us Shahnaz, Izzy, and Uzma. Assalamu alaikum, guys.
Walaikum salam.
Fantastic. So,
wow, that's a chorus. Come on. That's a proper chorus.
We've got so much to fit in. I can't say it to you separately, so I appreciate the chorus on that. Absolutely. So without further ado, we were discussing a very serious topic in the first half in regards to MMR, friend or foe, but in the second half we will be talking about Ramadan and preparing for Ramadan, which hopefully you've been hearing lots about on Inspire FM. Fahad, you feeling ready?
Oh yes, indeed. Always ready.
Fahad is always ready for everything, so that's a good place to be. So what we'll be doing, Shahnaz, is we'll be focusing the first half on talking about pregnancy and Ramadan, and then we'll be moving on to talk much more generally about healthy eating and Ramadan as well. So could I firstly ask you to just introduce yourself?
As I said previously, I'm Shahnaz Akbar. I'm a consultant gynecologist and obstetrician and subspecialist in reproductive medicine and surgery at Luton and Dunstable Hospital. And I lead the fertility and IVF services at Luton and Dunstable Hospital.
Fantastic. And I'm delighted to share with listeners that we are going to have a dedicated show on the 9th of May, which we will be discussing much more detail around fertility and pregnancy. And I know we've had a lot of interest in that show, so we're really looking forward to it. We're going to dedicate a whole hour to fertility and pregnancy with your expertise. We're also joined by Izzy. Could you introduce yourself?
I'm one of the nutritionists that work on the integrated lifestyle services in Luton, so Total Wellbeing, and I'm in the weight management team, so we run programs across Luton for families, adults and pregnant ladies too.
Fantastic. Thank you very much for your time. And we still have Uzma, Dr. Uzma Sawaz in there. Am I pronouncing your surname correctly?
Yeah.
Okay, fantastic.
I'll just say yeah. If it was my dad, he'd be saying Sarwar.
You don't pronounce it correctly. You just said Uzma.
That's a polite way of correcting it.
No. It's okay.
Fantastic. Local GP, we're delighted to have you joining us. Thank you so much for your time. So let's get on in regards to the specific topic about pregnancy and Ramadan. So Shahnaz, can you just share with us your expert opinion around, is it safe in Ramadan for a pregnant woman to be fasting?
Yes, Suliman, this is a very controversial issue because there are various studies performed which showed some evidence that it has some effect in terms of having premature delivery or smaller babies or a smaller placenta or less fluid around the baby. However, other studies, including the recent studies, they did not conclude anything. So still we do not know. And so we need to have plenty of more research on this subject. However, personally, I believe that pregnancy is a very demanding state on a woman's body in terms of nutrients and fluids, and also depending on her overall health in general, as well as the stage of pregnancy, whether it's first half of pregnancy, first trimester when she's very sick and vomiting, or the later third trimester when she's heavily pregnant, baby is full grown, and she needs in more demand, or as well as especially the time of the month, the Ramadan is falling the time of the year, if it is a very hot summer day. So yes, then she needs to take cautious, and I advise if a woman decide to go get observe Ramadan, then she should seek advice from her GP and her midwife to make sure she does not have any health issues or any contraindication to herself or her unborn baby. So she should be considered at low risk before she start observing Ramadan.
So if a pregnant lady want to fast, which is pretty much most of the ladies or men who try to fast during the month of Ramadan, what trimester that person should be that lady should be in, and what sort of health state she should be in?
Okay, as I just mentioned, it's her personal choice, which we should respect. However, for her sake of health and her unborn baby, she should seek advice from her midwife and her GP to make sure there is no contraindications. And when she considered as low risk, I suggest personally that she should not continuously fast, at least skip some days. And Islamic law allows the pregnant woman to opt out fasting or breastfeeding, which she can make up other time when she's ready. So instead of having continuous fasting, I suggest to at least have our weekends or at least 2 or 1 day skip between. And then she needs to focus more on her balanced diet and nutrition. She, at the time of Sahar, when she start fasting, so she should take foods which release energy very slowly, like foods which are having low glycemic index, which Lizzie may speak more about it. And also take foods which are wholemeal bread, wholemeal pasta, and cereals which are bran or oat-based, and as well as beans and some nuts which are not salty. And during the daytime, take rest as much as she can. If it's a hot summer, she should stay indoor and cool. And when she opens her fast, she should drink plenty of fluids, as well as consume food which are rich in water, like fresh fruits, fresh vegetables, soups and stews, and rest in between.
And like you say, because the fasts obviously at the moment are very long.
Yes,
I definitely feel they're long.
Yes.
I don't know about anyone else.
Seriously.
But, how long are they this year? They're like...
It's 18 hours. 18 plus minus. Uzma, you have recently gone through that phase. So have you fasted or have you skipped?
No. So I didn't fast. I personally,
Sorry, I put you on the spot.
No, that's absolutely fine. I was going to say, but in my experience, no. So I didn't fast just because, you know, I was feeling quite dizzy, definitely towards the end of my pregnancy, and actually it was just too much to handle, because I don't think you appreciate it until you're in that situation, but it's really, it can be really taxing, and it's difficult as well because you can't even put your shoes on and read namaz properly, so you feel a bit like, well, I'm not quite in the flow that I should be, and actually if Allah's given me this respite, then I'm going to take it. That was my thoughts on it anyway.
I suggest to have, if a lady would decide to fast, second trimester is the best time, because first trimester she's vomiting, sick, not eating properly, so she gets dehydrated, and which is not good for her. And third trimester, when she's heavily pregnant and baby is fully grown and she's very tired. But if she's low risk and she continue to fast, then skip the days in between.
So listeners, there's a reason why we do this show live, and that's to allow you to either call or text. So you can do that by calling us on, what's the number, Fahad?
01582 481822,
or call us or text us or WhatsApp us on
07779 481822.
Fantastic. He's know that number so much better than I do.
No, it's just behind you. I'm looking at you, but I'm looking at the number.
I should have covered it out like you did. So just finally, Dr. Shahnaz, just in relation to, are there any particular warning signs that if someone is pregnant and fasting they should look out for?
Yes, dehydration is a very common sign that woman should look into, because she's not drinking. So if she started feeling thirsty and passing very dark colored urine, she need to keep an eye. And if she started passing very less amount of urine, having headaches or dizzy, she should break fast, especially if she's feeling faint. And when she breaks her fast, she should take a very sweet drink and also some salty snack, or even oral rehydration salt, and rest, and should not fast for the few more days. And if she still continue to feel sick, dizzy and having headache, she should consult her doctor immediately.
Fantastic. Now I'm conscious you actually have to get off to a clinic, which is quite a commitment. So I just want to really thank you so much for your time this evening. As I say, for listeners that are interested in the fertility and pregnancy topic, we will be discussing that on the 9th of May, and so we're delighted that we'll be having you back in the studio, but we'll now graciously let you leave and see your patients. So thank you very much for your time.
Thank you very much for having me. Thank you.
Great.
Bye-bye.
Thank you so much.
Thank you.
So now we'll be moving on to discuss in more general terms, and I'm going to be asking Izzy most of the questions now in relation to obviously Ramadan is coming, and people might have already started doing their shopping to start getting prepared. People are more prepared than me.
Well, I was thinking of fasting today, because one of the things which I normally do before Ramadan to prepare my body is to fast Thursdays and Mondays. So definitely Bank Holiday Monday is a day off, so I will be definitely fasting on that day.
Great, there you go. So some people are already fasting and getting the practice in, which is great. Just showing off there, Fahad. But Izzy, I mean, from your experience, as you said, you do a lot around healthy eating and supporting people with weight management. And given the time that people are fasting, is Ramadan, is it possible to have a more balanced diet during Ramadan, given the fact that people are fasting for so long and therefore craving so many different foods?
Absolutely. So it's probably the best time to adopt a healthier lifestyle. If we avoid all like the fried foods which are traditionally eaten during iftar time, like samosas or pakora and things like that, it would do the opposite. It could lead to weight gain. However, if we maintain a balanced diet, try and include all the major food groups which are on the Eat Well guide, it is much easier to control your food intake, which also will help with aid weight loss and can reduce better control diabetes and reduce blood pressure in the long term as well.
Because it's interesting, because we most of us, thank you, most of us do open our fast with dates and water. So, generally speaking, it starts off quite healthily. Yeah. And then it just all goes downhill from there. With the samosas and pakoras and everything else like that.
Well, you can afford it, not me, unfortunately. You know that.
Yeah, I wish.
That's one of the reasons I was hiding all the numbers behind me.
I mean, this is the thing, though, isn't it? I don't think any of us can afford it as such, can we? Because of the impact that it's having on our bodies.
Yeah, and because the fasts are so long, you only need to eat a little bit to feel quite full very quickly. So it's really important that you make the most of that mealtime, so that you're replacing fluids and making up any missed nutrients or minerals or vitamins that would be lacking from not eating, and replacing water, which is also really important. Otherwise we will be constantly eating the wrong types of food, which isn't going to benefit us in any way, especially when you then go on to the night prayers and stuff. You don't want to be feeling quite fatigued and bloated and from eating the high fat, high sugary foods.
So we've spoken a lot about foods that we can't have. What foods would you then recommend specifically?
Yeah, so the doctor here, Dr. Shahnaz, she mentioned about trying to go for foods which are whole grain, whole wheat, low glycemic foods. So those are foods which are absorbed a lot slower into our bloodstreams and therefore will provide us with a sustained energy release. And you want to aim for that at both your meal times. We're only eating twice a day, so you need to make sure that you're getting, eating carbohydrates at each meal time, basing your main meal around a starchy carbohydrate, things like bran flakes, cereals, eating potatoes with the skin on, rice, basmati rice especially. It's shown to have a much lower glycemic than other, like your standard grain rice, so it releases energy over a longer period of time. Trying not to go for like fried foods or anything that's coated in sugar, like jalebis or mithai and things like that.
That means you are cutting down 99% of all the Asian foods which we normally have during the time of study.
She saved biryani. Yeah, you saved biryani, my friend.
But it's interesting because often we talk about what we shouldn't have. I think it's nice for a change to flip that around and talk about what we can have, and so biryani in moderation.
Yeah, it's a balance that you can add protein to it, your chicken or meat, you can add your vegetables to it, but it's also really important to make sure that we're not eating, for example, in your sahur meal time, it might be quite common to eat parathas and stuff, which is obviously going to be quite greasy, and with the butter that's added to it would be high in salt, so that might increase your thirst throughout the day later on. So trying to cook with wholemeal flour, eating oats in the morning, that would be a much better option to have than those foods, greasy foods that will probably not give us the energy throughout the day.
Izzy, in a general sense, definitely you are saying that don't eat any desi food, eat just English foods.
Well, I'm not saying not to eat.
No. You're not listening.
Then give us the quick desi options of those foods.
So rather than having a paratha, just have a normal chapati with wholemeal flour. You can still have your curry to go along with that. Just add some salad, maybe have some fruit or something to go along with that. It doesn't have to be greasy food.
So some of what you're saying is around cooking methods.
Yeah.
So it's around how we're preparing our traditional foods rather than necessarily not having any of our traditional foods.
Yeah, it all comes down to cooking methods. You can change the glycemic index of a food just by its cooking method. If you were to fry a potato, turn it into a chip, obviously that's going to be much higher in fat, therefore increasing the glycemic index, or by baking it with the skin on, it will be much, the energy will be released a lot slower. So it does come back down to cooking methods.
So only bakes and mussels for you, Suliman.
I can live with that.
Yeah.
I can't. Samosa and rolls are my lovely things.
And so obviously we spoke about dates in terms of, it would be dates galore in all the shops and in everyone's houses.
Yeah.
Are there any other kind of fruits and vegetables that you particularly think are keep you satisfied throughout the day?
Well, I know in our household we eat a lot of watermelon at iftar time. It's usually quite good because it's very I don't know what's the word, hydrating, because it's it's got high water content. So trying to start off with a bowl of watermelon or some fruit, maybe then go and pray, let that settle a bit, and then come back and have your dinner, your main meal. But the key is not to eat too much too quickly, because you will feel bloated. And when it comes to replacing water, not drinking enough, or if it's like 5 minutes before you've got to close your fast and you chug down a glass of water, that's not really going to do any good, because you'll probably excrete it out. Whereas like sipping throughout the whole evening in small amounts and making sure your body contains that would be a lot more beneficial as well.
There you go.
That's something which we do not
And dates, obviously, it is a sunnah to open the fast with the dates, and dried fruit generally is quite high in sugar, so it's fine to eat the dates at the time of opening your fast, because it gives us that spike in our blood sugar levels, so you have that bit of energy to break your fast.
And what about closing a fast, just before closing a fast? What's the best thing to have?
I generally just have like porridge or cereal or something. I'm not really a big eater in the mornings.
I can see that.
But yeah, I would recommend you try and drink as much between the two meals, and not having anything high in sugar or high in fat in the morning meal, because generally if it's high in fat, it'll be high in salt, so that will increase your thirst throughout the day, and also it won't give you that sustained energy release that we need, especially when the fasts are so long.
And so for some people listening, they might be thinking of the double benefits you might be able to have in Ramadan, which is where you're not only getting the reward of fasting, but because you're not eating for so many hours, if you are eating healthily when you are allowed to, are some people kind of being able to lose weight during the period, or does your body go into what some people call starvation mode?
So your body enters a state of like the benefits of fasting are seen after like 8 hours. We don't ever really go into starvation mode, because we still eat at the end of the day. So it's only after prolonged times of not eating, like days or weeks, your body really goes into starvation mode. But your body starts burning glucose or glycogen, which is stored glucose in our muscles and liver, as the first point of energy when we are fasting. Once that's been used up or depleted, your body then turns to fat stores, and that's where you would see the weight loss effects. If we eat and maintain a balanced diet throughout the month, you will see weight loss, because your body's turning to fat to produce energy. But if we're constantly then eating fried foods in the evening, you're not going to see that benefit, because you're just kind of replacing all of that with fat.
Sure.
Yeah.
I know a lot of people, I don't know, Uzma, if you found this in terms of a lot of people having Lucozade,
Why?
Or what, I mean, let's ask our guests, what are your thoughts on that?
I guess that's they're trying to think, we need to be rehydrated, and that's a very sugary drink, and they therefore go for it. But not my personal.
Yeah,
Lucozade is now not really recommended for diabetic people. Type 1 diabetic, it was part of the kit, but they are now taken off from the kits. So
because of the sugar tax, they reduced the amount of sugar. If you wanted to make a drink that would replace any lost electrolytes through dehydrating, just add a pinch of salt and sugar to a bottle of water or squash. You might struggle with water. Having squash and then adding a pinch of salt, sugar will replace any lost electrolytes.
Okay, that's cool. In your opinion, Doc, what should a person do during the month of at the time of opening or closing fasts?
Pray. No, I'm joking.
Definitely.
Just echoing what Izzy has said, this is, hopefully not to binge eat, which I think we can all do, and,
especially in the month of Ramadan, as soon as the fast opens.
All in moderation.
Let's go.
Yeah, so, I think it's just to avoid binge eating. And then it's interesting, actually. Can I ask a question?
Of course.
Sure.
Yeah, oh, there we go. Excellent. So, Izzy, I'm going to say family members who take it to the other extreme, right? So they will open their fast, eat a tiny bit, and a date and something or whatever, and then go to the gym. Yeah. Now, I'm sure you've probably heard this and seen this, and I think it's a young boy thing. I don't know if it's a reasonable thing to say, but I don't. What's your take on that as a nutrition side?
Everyone's different, so. Obviously, it's really important to make sure that you have got the energy to be able to do a workout, especially because the fasts are so long. it probably would be better to have a meal beforehand and then wait a little while and then do a workout, because you're more likely to digest your food better to then help prepare you for the next meal, because the window to eat, it is very short. So if you've had a meal an hour ago and then it's almost time to eat again, it can be quite difficult. So maybe eating first, even if it's just a light meal, it doesn't have to be a big meal, just so that they've got the energy to do the workout, because otherwise you could end up with feeling really tired, fatigue, and it would be really difficult to replace any glycogen that would be used up through the exercise.
Because I think one of the concerns is around, so I know some friends of mine who have throughout the year spent a lot of time in the gym, and like you mentioned earlier, one of the concerns is you're losing a lot of muscle mass through the process, and so have plans that after the night prayers, because there's only so much of a period to go to sleep, so they're then thinking they're going to use that period to go to the gym, just to try and maintain the hard work that they've done throughout the year.
Yeah, you only lose muscle mass once your body goes into a real state of starvation, and we never get to that state. So they might feel like they're losing weight or muscle mass, but it's not that. It'll probably be like water weight or something. So you'd only really lose muscle mass after like full days of fasting, but we always eat at the end of the day, so there wouldn't be like a massive risk of muscle wastage. Sure.
As we almost near to the end of the show, so what are your messages for our lovely users or listeners who eat like hell, especially in the month of Ramadan?
There's nothing wrong with eating or making a bit more of an effort with food, especially if you're providing food to other people, like family, friends, neighbours, to break their iftar. It's nice, and it is like a sense of, it is like a coming together of the community, but we shouldn't differ our everyday eating patterns to the other extreme and have all like these fried foods. It can interfere with one's spirituality. We should be focusing on getting closer to or strengthening our religion or faith, but we are actually running a 4-week Ramadan course as part of Total Wellbeing. I'm working on it at the moment, so that will be running on a Thursday afternoon from 5 till 6 p.m, and it will be around healthy eating. We will have one of my Stop Smoking colleagues to offer support for quitting smoking, and also a bit of light exercise, so yoga as well. So if there are any listeners out there that want to take part, just go on the Total Wellbeing Facebook page, and we have all our contact details on there.
So people can self-refer themselves?
Yep.
Fantastic. So there you go.
And Uzma, what's your final message?
I think I'm going to take away that I can have biryani.
Lots of fruit with it. Fantastic, great. Jazakallah khair to all of our guests. Really appreciate that. We'll be back again next week. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.